Ondansetron is a medication primarily used to prevent nausea and vomiting caused by cancer chemotherapy, radiation therapy, and post-surgery. It belongs to a class of drugs known as serotonin 5-HT3 receptor antagonists. Ondansetron is also known by the brand names Zofran ODT, and Zuplenz. Common side effects of ondansetron include headache, dizziness, drowsiness, constipation, and fatigue. Less common but more serious side effects include QT prolongation, which is a rare heart rhythm condition. Serotonin syndrome, especially when used with other serotonergic drugs. Allergic reactions such as rash and itching. Ondansetron works by blocking the action of serotonin, a natural substance that may cause nausea and vomiting. Specifically, it antagonizes the 5-HT3 receptors located both centrally in the chemoreceptor trigger zone and peripherally on vagal nerve terminals and the gastrointestinal tract. The dosage of ondansetron varies depending on the type and severity of the condition being treated. For chemotherapy-induced nausea and vomiting, the dosage for adults is 8 mg orally twice a day or 24 mg as a single dose before chemotherapy. The pediatric dose is weight-based, usually 0.15 mg per kilogram, given intravenously 30 minutes before chemotherapy. For radiation-induced nausea and vomiting, the dosage for adults is 8 mg orally 1 to 2 hours before radiotherapy, followed by 8 mg every 8 hours for 1 to 2 days after completion of radiotherapy. For postoperative nausea and vomiting, the dosage for adults is 16 mg orally 1 hour before anesthesia or 4 mg intravenously at the induction of anesthesia. And for pediatrics, 0.1 mg per kilogram IV before surgery. Ondansetron can interact with various drugs and substances, including medications that prolong QT interval such as certain antiarrhythmics, antipsychotics, and antibiotics. Serotonergic drugs such as selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, monoamine oxidase inhibitors, and other antidepressants, which can increase the risk of serotonin syndrome. Concomitant use of apomorphine is contraindicated due to the risk of profound hypotension and loss of consciousness. Ondansetron is metabolized by the liver enzyme CYP3A4, and drugs that inhibit or induce this enzyme can affect its levels. Several warnings when using ondansetron should be considered. Ondansetron can cause QT prolongation and should be used with caution in patients with a history of heart conditions, electrolyte imbalances, or those taking other QT prolonging drugs. Use caution when administered with other serotonergic agents as it may cause serotonin syndrome. Patients with known hypersensitivity to ondansetron or any of its components should avoid using it. The safety of ondansetron in pregnancy is not well established. It should be used only if clearly needed. Ondansetron is excreted in breast milk, so caution is advised when administering to breastfeeding mothers. If you found this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.